Hi, my name is Christa. I'm a registered nurse lactation consultant, IBCLC, and I just wanted to share with you guys some of the kind of general guidelines for normal newborn behavior. And once again, this is for a full-term baby, typical behavior after delivery. So once a baby's delivered, they generally want to eat a little while at the breast. That's when they're most active. Then after that, they generally want to sleep for about a day. That's what we call the birthday nap. So during that time, I really educate the mom to try to sleep as much as she can, get as much rest as she can, and that sort of thing, because later on after that, the baby's gonna wanna wake up more, wanna feed more, and that is normal. Educating the mom that the baby wakes up a little bit more after 24 hours, closer to that time frame, trying to kind of educate her to say, this is what's going to happen. Sleep when you can so you are rested and ready for baby to feed. Sometimes if the baby starts feeding kind of non-stop, we call that cluster feeding, closer to 24 hours, the mom may think she just doesn't have any milk, and that's not the case. So babies sleep for a while and then they wake up and they want to eat kind of constantly at the breast. Once again, that's called cluster feeding. That's really just trying to help mom's colostrum, get all of her colostrum out so her mature milk comes in faster. That will also happen anytime baby is going through a growth spurt. So at 1 week, 2 weeks, 1 month, 2 months, and that sort of thing. Anytime baby is going through a growth spurt, baby's gonna wanna eat a little more constantly. So telling that to mom in postpartum and setting her up for success for her breastfeeding goals is really going to be beneficial for the mom and baby. Letting her know that 2 weeks from now, if baby starts kind of eating constantly at the breast, that's not because mommy doesn't have milk. Baby is just growing and needs a little bit of extra food at that point in time. And I also tell moms that we don't really expect baby to eat a whole lot the first day. We don't want baby to just camp out in the bassinet for hours on end. We do want to keep attempting to feed him. But we don't expect him to actually have very good feedings every 3 hours. We do recommend to try feeding baby about every 2 to 3 hours, and that's 8 to 12 times within a 24-hour period. But he's not going to eat that often or that much for the first day usually. And once again, every baby and every body is a little bit different, and so this is kind of general speaking, okay? So if it's been 3 hours since baby's fed, then yes, we want to encourage the mom to try to breastfeed. Start off doing skin to skin with baby, strip him down to just his diaper, and put him right on mommy's bare chest. That's gonna help mommy's milk to come in, because mommy will be bonding with her baby. She's gonna be smelling him, she's gonna be releasing hormones. Also, when baby is doing skin to skin, that's gonna help regulate his blood sugar, his temperature, all of his vital signs, just doing that skin to skin. And then if mommy is too tired to do skin to skin, daddy or whoever else is in the room can also do that, and baby will benefit from it as well. Sometimes if baby is doing that skin to skin with mommy, he's also going to be smelling mom and getting in the mood to eat. And then if baby is still not very interested in feeding, not really awake, mommy can do really good hand expression, breast massage, just literally rubbing her breast in circular motions, whatever she is comfortable with, trying to engage all the breast tissue. And whatever colostrum she gets, she can just take a clean finger and get the colostrum and let baby suck her finger that way. That kind of will act as an appetizer sometimes to get baby in the mood to eat a little bit more. So these are all kind of tactics that we use, lots of skin to skin, massaging the breast, giving baby what we can here and there. Those are things that we can do to entice baby to feed. So as long as baby is pooping and peeing adequately, as long as the weight gain is good, there's really no concern to start supplementation or anything, especially the first 1 to 2 days in the hospital, because mom's body is going to start adjusting, realizing the baby has been born. Mom's body is going to start making milk for her baby. And then baby's belly is only about this big right now, so about the size of a cherry for the first day. And then usually baby's belly has a lot of amniotic fluid and stuff, so baby doesn't realize he's hungry. He has a lot of fluid and stuff in his belly. The more baby cries, the more that fluid breaks up, and also that kind of is transitional and goes away closer to 24 hours, that's when baby gets more awake, realizes he's a little more hungry, wants to feed a little bit more, do that cluster feeding. So all that is normal. As long as we educate the mom that baby needs to have at least 1 wet diaper for the first day of life, the first 24 hours, 2 wet diapers for the second day of life, 3 wet diapers for the 3rd day. That pattern continues until day 6, to where baby will need at least 6 wet diapers a day. By then, baby's belly is a little bit bigger, mommy's milk is in, so baby's going to be getting more fluids throughout the day. We also, whenever we do have baby breastfeed, we want baby to tell us when he's hungry and when he's had enough food. So we don't really want to watch the clock. We want to pay attention to how much time has gone by. If it's been 5 hours, then yes, we definitely need to attempt to feed baby and hopefully have a good latch to where he gets food. But usually baby's going to tell us when he's hungry. Okay, if we, of course, have baby bundled up nice and comfortable, then probably not. We need to get baby a little uncomfortable. Do that skin to skin. Don't keep him swaddled up away from mommy, nice and cozy all the time. Do a diaper change. Get baby stimulated a little bit. Have him smell mommy. Things like that to kind of encourage him to wake up for that feeding. So when baby starts rooting around, doing his head from side to side, trying to eat his hands, let's offer the breast. When we get baby latched on, we want baby to be turned tummy to tummy if mommy is doing the cradle or the cross cradle position. Okay, football hold is just like this. And then when baby is at the breast, we want more than just the nipple in the mouth, but some of the dark areola. And then, like I said, every body and every mom is a little bit different. All the anatomy is a little bit different as well. So the thing is, we want mom and baby both to appear very comfortable, okay? And then we want baby's lips to be flipped out like a fish and not tucked under. If they're tucked under for the feeding, then we want to have mom gently flip them out with a fish hook, okay? And then baby's going to tell us when he's done eating at each breast. We don't want to put baby on a timer. It's been 10 minutes and switch baby. Baby's going to let us know when he's done with that breast. He will gently push off the breast, or he'll start to fall asleep at the end of a feeding. We don't want baby to sleep at the breast, so we would of course then take him off, put him on the chest, do some skin to skin, burp him, whichever way mom is more comfortable with burping. If mom is comfortable burping baby like this, turn the head and burp. If mom is comfortable burping like that after a feeding, then perfect, that's great. And then we can offer the other side if baby is interested. The reason we want baby to eat all that he wants on one side is because the milk at the end of a feeding is higher in fat. So that's really going to help with baby's weight gain. So having baby tell us when he's done, burp, and then offer the other side if baby's interested. If he does not want the other side at that time, then of course start with the other breast on the next feeding. Obviously, if there's any issues with baby eating or any concerns that baby's not getting enough, then you do want to let your pediatrician know, let your nurse know, involve a lactation consultant so we can address whatever problem there may be. But that's it. Thank you.